Hello, good morning, good afternoon, good evening, depending on the location where you're watching me from. You are welcome to today's program. Today being the 30th of March. All right, the year, the month, the days are running fast. Already we are in March. So you are all welcome to today's, should I call it midday or evening program, depending on the location where you are watching me from. All right, you are all welcome to today's program. So let's see what we are going to discuss today. Let's see what we shall discuss today. The topic we are seeing, all right, the topics you are seeing is um, the topics you are seeing. That is the topic questions to ask your doctor. I'm going to show you guys the real topic because the title is very long. So because of that, I was not able to put everything. All right. We shall be discussing diabetes treatment. What are the important questions to ask your doctor after you have been diagnosed for the first time that you are diabetic? All right. So that is what we are going to be discussing today. What are the first question? They are the most important questions to ask your doctor after you've been diagnosed as a diabetic the first time. So we're going to go through those questions one by one today. All right, we're going to go through those questions one by one today. All right. How are you? Where are my friends? Where are you guys? Join the program and let's get it started. All right. Happy Easter. Happy Easter. Happy Saturday. All right. Happy Easter. Happy Saturday. You are all welcome to today's program. All right. We're going to be discussing diabetes treatment. What are the important questions to ask your doctor after you've been diagnosed as a diabetic for the first time? So we're going to go through the list of questions that you should be asking your doctor just to be conversant with what diabetes is all about, what to expect and what not to expect while you are about to start your treatment. So those are the things we shall be discussing today. Please indicate to me where you are watching from. Once you join the program, kindly indicate to me your name and the location where you're watching from so I can give you an acknowledgement and then we can now ride on with our questions, with our discussion, please. Sam, to you, I have Selena. You are welcome, Selena. Where are you watching from? I think this is the first time to see you here. Ajay Jan, that name sounds like a Ghanaian name. I don't know if I may be wrong. All right. So where are you watching from? Selena, where are you watching from? So I'm waiting for everybody to come online. So I'm right. You're watching from Ghana. Okay, you are welcome. You are welcome. You are welcome. I believe you are a diabetic or you are looking after somebody who is diabetic. Okay, so now I'm just going to try to discuss the intros, and then once I'm waiting for everybody to join the program. I'm looking at the number. Once the number get to a certain number, number figure that I'm waiting, then I will go into the topic in details. Now, once you are diagnosed as a diabetic for the first time, there comes with confusion and short of words. You are confused, shocked, and short of words. Oh, okay. All right. Thank you very much, Selena. All right. I'm a new member on diabetes. Okay. Thank you very much. Okay. So once you are diagnosed for the first time as a diabetic, okay, you're welcome. Josephine Amara from Sierra Leone, you are welcome. All right. So once you are a diabetic for the first time, there comes with a kind of shock. All right, confusion comes in. You start stuttered. You know, when I say stuttered or you are murmuring, you don't know what to say because you don't have a clue what diabetes is all about, or you have a faint knowledge of diabetes, but not in details about diabetes. Okay, Lucy, you are welcome. All right. So, so, so you are shocked because you don't know what the hell the doctor is talking about. Okay, and most time, most doctors, especially doctors in Africa, when they are discussing your illness with you, they use a lot of medical terms. You see a woman that sells something in the market, okay, an elderly man or a child or an infant. All right, it's only in Africa that I see most of the doctors use medical terms, okay, to interact with their patients or discuss or explain to their patients what illness they are going through or being diagnosed. You know, and I find it very, why should it be so? This is a woman who sells something in the market or on the street. Why using medical terms explaining her situation to her? You break it down using a simple language that she can understand. Because most time when you use medical terms, you put them into confusion. They might spend 30 minutes with you in that office, and as soon as they walk out even more confused because they don't even understand what the hell you are talking about. Because for the first 30 minutes, you're using medical terms to try to explain what the illness is all about, instead of you to try to break it down for them to understand and walk out of that office understanding the situation. So when you are diagnosed with diabetes for the first time, you might not even know, because generally in layman, what they understand with diabetes is about, oh, it's a sugar illness, sugar disease. That's all they understand. But there is more to it. So once you are diagnosed with diabetes for the first time, okay, there's a kind of shock and confusion that comes in. And you ask yourself why. So, and you don't know where to start and where to end. And the doctor is not even helping you to explain to you how to go about it, because in that discussion, he's using all kinds of medical terms he learned from the school, thinking that you understand it. And when you try to ask the doctors, hey, please, can you explain what they become annoyed. They become annoyed because they are, you ask them too many questions, and that is not professional because you are putting that patient into confusion. And that is why in this page, I hardly use medical terms, because I want you guys to, if we are going to spend 1 hour here, I want you guys to spend your time 1 hour here, understand what I'm talking about. I don't want you to spend 1 hour here and then leave the program more confused. So I try as much as possible not to use medical terms. Before I even start a program, okay, I prepare my notes, I do everything, try to make sure if I see a medical term, I try to find another word to substitute to that medical, except I cannot find another word. Then I have no choice to use that medical words to explain what I'm trying to say. So once you are diagnosed with diabetes, there are important questions you are supposed to ask the doctor for the first time. Okay, the first time, you're welcome. All right, the first time you are diagnosed with diabetes, there are important questions you're supposed to ask your doctor, so that we're going to go through the list of that. I think I was able to get about 13 questions. They are very, very important. There are many questions, but I selected the most important 13 questions to ask a doctor once you're diagnosed with diabetes for the first time. So we're going to go through the list of those 13 questions. All right. All right. So now I'm going to do something. I'm going to do something now. Now, this is because the topic is there. You guys can see the topic, diabetes treatment questions to ask your doctor. The title of this video is long, so I make it short. So this is the real topic. I'm going to share the real topic. This is the real topic. Okay, because this cannot fit into the line. So this is the real title of the topic we are going to discuss today. That is the real title of the topic we are going to discuss today. Important questions to ask your doctor after you start a new diabetes treatment. I was able to get 13 out of so many questions. I was able to narrow it down to critical 13 questions you're supposed to ask your doctor initially after you've been diagnosed with diabetes. Now, before we go in, I'm now on TikTok. Okay, I posted it on my page. It's a new page on TikTok. So please, if you are a dedicated follower to this page, if you are really, really committed to this page, okay, kindly go to TikTok and subscribe. Follow me on TikTok. All right. Let me share. Okay. First of all, let me do something here. Just a minute. So on TikTok, this is the name Managing Diabetics on TikTok. Okay. If you go to TikTok, search for Managing Diabetics and then follow me on there. Okay. I'm making an arrangement to also do a live broadcast on TikTok as we go on. So if you are dedicated, if you are a fully dedicated member of this page, you also go to TikTok and follow me on that page. All right. That is my TikTok. That's the name on TikTok. Okay. That is the name on TikTok. Just a minute. Let me see something here. All right. So now I'm posting a link. Okay, on the comment section. That is the link I just shared on the comment section. So you can also click at that link. If you click on that link, it can direct you. Okay, I don't know if that link is going to work, but if that link is going to take you to Facebook, no, forget about that link. It's going to take you to Facebook, so it doesn't matter. I'm going to remove it. Just go to TikTok. For those that are dedicated, go to TikTok and also follow me on that page if you are a dedicated follower on this page. Okay, let's also grow that page. Trying to remove this. All right, so if you're a dedicated follower, go to TikTok. That is the name on TikTok, Managing Diabetics, and then you can also subscribe there. All right, so if you're a dedicated member, die-hard dedicated member, because there are people who are not dedicated member, they just come once in a while, or when they have a problem, they just come in, ask a question and disappear. You won't see them again. I know my dedicated followers here, they are with me all the time. All right. So if you're a dedicated follower to this page, kindly go to TikTok and follow me, subscribe to that page. Okay, let's go. Now, this is the complete topic of what we are going to be discussing today, because the other topic I put, you see, I have, let me remove this because this is not going to fit. Okay, so I use this short one, but the real topic is this. Okay, so I selected 13 questions. So let's go in now. So those that are coming in are going to join later. So starting a new type 2 diabetes treatment may seem tough. As I said, it may seem tough, especially if you were on your previous treatment for a long time, or if this is your first time to start treatment after your diagnosis. So to make sure you get the most out of the new treatment plan, all right, or a revised plan, it is critical to communicate with your diabetes physicians or your family doctor on how to manage your diabetes. Okay, so that is what we're going to discuss today. What are those 13 important questions you are expected? As I said, the first time you are diabetics, there's confusion. You don't know where to start. You don't have a deep knowledge about diabetes. All you know is a sugar illness. Okay, and you think that by the time you stop adding sugar to your tea or whatever you are taking, you are okay. No, there is more to that. So your doctor may have changed. There are reasons why you may need a new diabetes treatment, or why you have to start a new diabetes treatment if this is your first time as a diabetic. So your doctor may have changed your diabetes treatment or put you on a diabetes treatment because, for instance, if you are previously on a diabetes, there are reasons why your doctor may start a new diabetes treatment with you. If this is your first time as a diabetes, there are reasons why doctor will insist to say, you know what, I'm not going to give you an option to manage your diabetes with dieting and exercise. I must put you on medications, or I'll put you on medication and then combine it with exercise and dieting. So your doctor may have changed your diabetes treatment because your prior treatments no longer manage your blood sugar levels or medications that is causing you a debilitating side effect. So the doctor can start a new diabetes treatment with you and then do away with that particular medication that is causing you a serious side effect. Or your new treatment plan may include adding a drug to your current regimen. And I told you guys yesterday, there are several reasons why doctor might say, okay, you have a side effect. There are some medications that don't work alone. You have to add another medication on top of that medications to work along. So your doctor may start a new treatment plan by adding or including a new drug medication to the current one you are doing to get rid of that side effect. Okay. Now, or entirely, your doctor may stop a medication and start a new one. Okay. Start a new one. So if you feel that the side effect is severe and it's causing you more problems, you must say, okay, you know what? Your body is not accepting you this medication. Let's do away with this medication and then start a new one. All right, and start a new one. It may also include, okay, diets and exercise. So these are some of the reasons why doctor may try to change a new medications or add a new medication, or in conjunction of dieting, medication, and exercise. All right, okay. And another reason doctor may try to change your medications is the timing or the target of blood sugar range is not in conformity with the medication you are taking. Remember, there are some medication, diabetic medication, you have to take at a specific time. Okay, you must take them daily at a specific time. Anytime you miss that timing, it will affect your sugar level. So these are certain things doctors take into considerations to either change your medications, add your medications, or entirely add a new one to the current one you are taking. So if your current treatment, okay, has worked well, then stick to what you are doing. If it has not worked well, then discuss with your physicians on which is the better way, okay, to manage your diabetes very well. So that's some of the reasons why doctors, because somebody asked me that question yesterday and I want to get it out of it now. You know, somebody asked me that question yesterday, so I just want to get it out of now, and let's go to the main topic today. Now, what are the most important questions to ask your doctor throughout the first year or the first time of a new diabetes treatment? We're going to go through the list of 13 important questions that I've rounded up. There are several questions, but I choose 13 important questions to ask your doctor. Diane is asking, why am I sweating? It's sweating to stop. I think this light is making me to sweat. Diane is asking, does housework count as a form of exercise? Yes, it can. Housework in some ways count as form of exercise. You know why I say that? Remember in my previous videos, I say if you're a diabetic, you must be moving around. Diabetic, you cannot be stationary. As a diabetic, you must be moving around. That moving around is part of exercising. And if you guys remember in my previous video, I said, if you are doing a desk job, if you have a desk job, 9 to 5, computer job that when you go to office, you have to sit down in one place, it is not good for you as a diabetic. Because I say you must add form of exercise. So for instance, you say, okay, if I walk every 2 hours in my desk, I have to get up and move around for 10 minutes and come back and continue. So you must involve moving around as part of your daily schedules at work. So housework, yes, is part of exercise because it entails you moving around. But when I say housework, does not mean you just walk to the kitchen, drink water, and come back and sit down. You say that's exercise. No, you must be walking around. At least your whatever housework you are doing must at least make you to be moving around at least minimum 15 to 30 minutes. Okay, not just okay, let me just go to the kitchen, grab something and come and sit down. It's okay, that's a housework. Or no. Sweeping, yes, if you are sweeping the house or hoovering the house, yes. Okay, cleaning, as long as you are moving around, yes. That is why I say even gardening. If there are some people that have gardening in their compound, that gardening is also good exercise because you are bending down, you are standing down, you are moving all parts of your body, and you are sweating. That is a good exercise. You are cutting grass, weeding the compound, all those are exercise. You are sweeping a big compound, you are moving around, that's a good exercise. All right, you are climbing the stairs. If you live in one-story building, you climb the stairs up and down all the time. Those are good exercise. So housework count as exercise, but it depends on the type of housework. If it's a housework that you can just do within 2 minutes and you sit down, that is not exercise. Any housework that you can do within 2 to 5 minutes and sit down, it's not exercise. It must get up to 20 minutes and above. Consistent 20 minutes housework, that is good for you. All right. Julie, you're welcome. All right. So let's so this is what we are discussing today. So I'm going to remove it. So let's look at what are the important questions to ask your doctor throughout the first year after your initial diagnosis of diabetes. Okay, let's look at those critical 13 questions. Okay, now, for instance, if for the first couple of weeks, okay, it has been challenging. As a diabetic, it has been challenging, for the first couple of weeks, it's going to be very difficult for you to handle your diabetic situations. The most challenging after starting a new treatment because of your body must adjust to a new medications. And that new medication might tend to come with side effects because your body is not used to those medications. But when you take it consistently for a week, 2 weeks, it might readjust and those side effects will disappear. Okay. And your lifestyle changes. You are going to make a very big lifestyle changes once you are newly diagnosed as a diabetic. So all those your favorite food, all those your non-favorite drinks, all those you're going to a restaurant, all those going to the street to buy food have to entirely stop. Those are lifestyle changes that have to stop immediately. You have to empty your cupboard, throw a lot of things out, and now try to readjust on the type of food to eat. So now we are going to go to some of the questions, okay, to ask your doctor, not only in the first 30 days, all right, or after treatment, but also throughout the first year. So I selected 13 good questions. So let's go to the number 1 question. All right, if you guys can write it down, anybody who wants to write it down can write it down. Let's go to number 1 questions. Why am I sweating? This light it's like it's making me to sweat. Why am I sweating? All right. So let me share a link for those who want to join the program live. If you want to join the program live, this is the link. Okay. If you want to join the program, if you want to join me live on this program, you click on this link. That's the link. Download it, open it in your browser, download it, and then follow the instruction on how to join. It's going to bring you into the on my site, and I'm going to accept you. So for those who want to join the program live or discuss their side effects. So let's look at the first question. The first question, all right, is, are these side effects related to medications? Okay. The first question is, if you are currently on medication, all right. So for instance, if you are currently on medications, okay, you can ask your doctor, are these side effects related to medications? So for instance, if you're experiencing to medications, or if doctor is prescribing a new medication to you at the first time, and then the doctor is telling you that this medication may come with side effects. Say, for instance, you come to my office now, and after seeing your result, and I say, oh, you know what? And I'll start writing my prescriptions, and I'm trying to educate you how to take the medications. And I'm also advising you that this medication may or may not have a side effect in you. Then you can ask me, those side effects, are these side effects related to those medications? That is one question. Are these side effects related to those medications? So if you are taking a new medication for the first time, you may experience new side effects. You might feel dizzy or have digestive problem or a rash. Normally, you might have some stomach digestion issues or some stomach pain. Your doctor can help you figure it out if these are from the medications and advise you on how to treat them. So if you are starting a new medication that can cause you your blood sugar, your low blood sugar, be sure to ask your doctor and team, what are the symptoms to watch out? Say, for instance, when the doctor is trying to explain to you, because if that's your first time, okay, if that is your first time, they are trying to explain to you, okay, I'm giving you these medications, you have to drink it with water or drink it with food, okay, and these are the times you have to drink it with. Don't take this medication in an empty stomach, okay? Now, the doctor is going to have to advise you, these medications may or may not have side effects, okay? You are listed. So once the doctor finish explaining, you may ask the doctor, this side effect, is it due to the medications or due to any underlying illnesses that I might have? Then the doctor may explain to you that some people might have side effects due to the medications or not. As I say, side effect differs from individuals to individuals. Now, after explaining those things to you, you also have to ask your doctor, what are the symptoms of those side effects to look out for? So the doctor is going to explain to you, once you start having side effects, these are the symptoms to look out for. And when this starts happening, this is what to do. And as I said before, if your side effect lasted for 7 days or more than 7 days, then you have to go and see your doctor and discuss the severity of those side effects, and the doctor can do some modifications to your medications. All right. So that is why you have to ask that number one questions when the doctor is prescribing the medication and explain to you how to take the medications and the impending side effect of those medications. You cannot ask the doctor, is the side effect due to the medication I'm taking or due to the underlying illness that I may have? And if the side effect occurs, what are the symptoms to look out for? So that is number one question. All right. So let's go to number two question. Let's go to number two question. You guys want me to write it down for you guys? Okay. Okay, just hold on. Remember, this is the topic we are discussing today. This is the real title of the topic, because on the other one this is too long. So this is the topic we are discussing today, the important questions to ask your doctor after you start a new diabetes treatment. Okay, now so now what to ask your doctor through the first year of your new diabetes treatment. And I said number one. Okay, number one is this is number one. All right. Are these side effects related to my medications? I've explained to you guys why you should ask that question. Let's go to number two. Is there anybody there? Are you guys listening? I want to make sure that somebody's there listening. Are you guys there? Can you guys? I want to see who is available there, who is listening. Can you put it on the comment section? Who is there? Okay, Julie is there, Carol is there, and Selena is there, Diane is there. Okay. All right. Nalu, you're welcome. From Zambia, Carol is there, Diane is there, who is there, Selena is there. All right, Julie is there. Okay. All right, so let's go back to number 2 question. Okay, number 2 question is, this is number 2 question. All right, for those that are joining us now, let me go back a little bit. This is what we're discussing today. For those that are joining us now, this is what we're discussing today. Topic: important questions to ask your doctor after you start a new diabetes treatment. Finish the intro, and these are the questions. We are going into the questions to ask your doctor now. And I just finished discussing number 1, and then I'm at number 2. For those that are joining us now, okay. So number 2 question is, Regina, you're welcome. So number 2 question is, will my side effect go away? So will my side effect go away? Remember I told you guys, okay, many times as you started new treatment, most of the time, not everybody, you might experience side effects due to the medications you are taking. All right. Now, and I said to you guys, if that side effect, ask your doctor, would that side effect go away with time? And I said to you guys, in the beginning, some medication, once you start taking them continuously, your body is going to recognize now that you are taking this medication, because by now this medication is already in your blood system. So a week or sometimes 2 weeks, those symptoms will disappear and then you'll be okay. But if medically, they will tell you that if the side effect lasted for 30 days, you have to allow it for 30 days. If the side effect lasted for 30 days, okay, after 30 days, then go and see your doctor. But I tend to shorten it to say 7 days or 14 days, because I belong to the class of, I'm the way I do my own things, I try to be preventative. Okay, I don't want to delay things when it gets worse. I try to be ahead of time, to practice preventative measures to make sure you prevent them at the earliest stage. Medically, they will ask you 30 days. Wait for 30 days. If the side effect lasted more than 30 days, then go and see your doctor. But on my own case, I try to cut it short, 7 or 14 days maximum. After that, go and see your doctor. The earlier, the better. Okay, because you might be taking that medication for 30 days. The more you take it, the more it's going to be severe and cause you more damages. So I try to shorten it to say 7 days or 14 days maximum. But medically, they will say wait for 30 days. So ask your doctor, will my side effect go away with time? So the doctor is going to tell you, okay, yes, a week, 2 weeks, or after 30 days, if you still have that severe side effect, come back to me. All right. So, and then that is what doctor is going to advise you. Okay, because as you start taking the medications, as a new medication, new patient, that medication is not yet in your blood system. So as I said, you may not even have the side effect. It differs from individuals to individuals. So, but if you have it, okay, try to ask doctor, would there be any improvement? Would the side effect get better with time? Some doctors are going to explain to you yes. Because of their experience using that medication, they will tell you yes. Due to the experience I've been giving to my patients in the past, you see that after 7 days or 14 days, you start getting an improvement. Then at least you know the doctor is giving you assurance. So when you start seeing those side effects, you know that within 7 to 14 days, it's going to disappear. Then the doctor is going to advise you that if you have it severe, if that side effect lasted for 30 days or more than that, then come back. Okay? And then if you don't expect any improvement, come back, and then he will now see if he's going to change the medication to you or add a new one or reduce the dosage. So the second question to ask your doctor is, will my side effect go away with time? Let's go to number 3. Okay, let's go to number 3 question you have to ask. Somebody is there. Let me see who is here. Nalu, yes, I know you are here. Nalu, you're welcome. All right. Let's go to number 3. Number 3 question is, are my blood sugar levels okay? Okay. Number 3 is, are my blood sugar levels okay? Now why I put are my blood sugar level okay in the number 3 question, okay, is once you started treatment, we finish with the side effects. And remember, doctor is going to give you an appointment to come back in 3 months' time to do your A1C test. All right. And then you came, you go send for your blood work, and then he asks you to come back again for the result. And then you come back. Doctor is going to go through the result with you. Or alternatively, you are taking, remember I told you guys, you must have your clinical logbook at home. You must record your own sugar level at home. It is a mandatory, you must keep it with you. And then when you go to see your doctor, you present your own sugar level, sugar testing at home with your own result, with the result doctor has. And the doctor is going to go through the numbers. Numbers talk to doctors if your diabetes is improving or you are doing the right thing. Now, once doctor talk to you, you can ask the doctor, are your blood sugar levels okay? Because you might be seeing something different. Your mind might be telling you something different, but when he is looking at it, he's a professional. When he is looking at it, there are things he sees that might not look okay, or might look 50-50 okay. You are free to ask your doctor, now I've gone to do my blood work. The result is my blood sugar level okay? Okay. So, and the doctor is going to now tell you that this question is very important. Never you walk out of your doctor's office without asking if your blood sugar level okay, because that is what you are fighting for. This particular question is very, very important. That is what you are fighting for, to make sure doctor tells you you are doing okay or you are doing bad, or he tells you what and what to do to make sure the number looks okay for the next time. Okay, so assuming you are regularly monitoring your blood sugar, you should share the result with your doctor. That's what I told you. Once you are doing at home, bring it to your doctor and share with your doctor. Ask if your blood sugar level were where they needed to be within the first month or so of your treatment. Then if your levels aren't up normal, doctor is going to advise you. But this question is critical. This particular question, always ask your doctor, because there are several numbers on that test. One might be okay, the other one might not be okay. Then if one is okay and the other one is okay, there's something wrong in your system that needs to be corrected. So don't look at, for instance, you might see your glucose level number is okay, and your A1C level number is not okay. Or your A1C level is okay, your glucose number is not okay. Or your glucose number is okay, your A1C hemoglobin test is okay, but your triglyceride is not okay. Because triglycerides have to do with your high blood pressure and the cholesterol. Okay? So if your A1C level is okay, or your glucose number looks perfectly fine, your A1C number is okay, but slightly higher than your glucose number. Okay? They are okay, but one is much better than the other. There's a reason for that. Okay? Or you look at your triglyceride number, look at your LDL and HDL. Okay? They are not okay, even though your glucose number is okay. Then, because numbers communicate to the doctors. So that is why you have to ask your doctor these particular questions. Are my blood sugar levels okay? And let the doctor explain in details what he or she is seeing on your result for the first month you started your treatment. Because that will tell the doctor a lot for the first 3 months you started your treatment, the trend where you are heading to, or if you're heading the correct way, or you are stagnant, or you are going the wrong way. So there are different numbers doctors look at your medical result, not just the glucose number and your A1C number. There are other things they look at. They also look at your urine result to see if there's any culture in your urine result, if there's any protein or pigment in your result, or if there's any sugar in your result, okay, especially the culture or the coloration of your urine, these are very, very vital. So there are different things doctors look at in your result. But most importantly is that ask your doctor if your sugar level are okay. So doctor will go into details and then explain to you, this is okay, but there's something I'm seeing in this area that needs to be worked on. So that is the third question. Ask your doctor, share your result, what you're doing at home, and then the one he has at office, if they are okay. All right. So let's go to number 4. Number 4. If you guys, anybody has any questions, feel free to ask me. Okay. Number 4. Let's go to number 4. Number 4 is how often. How often should I check my blood sugar levels? How often should you check your blood sugar levels? This is very important also. As a diabetic or as somebody who is newly diabetic, ask your doctor, how often should I check your blood sugar levels? Okay. So when starting a new treatment, okay, your doctor may want you to check your blood sugar levels more often throughout the day. Some doctors are going to tell you, some doctors are going to be just tell you, check your blood sugar more often throughout the day without giving you a specific number. Some doctors are going to tell you, due to, now, if a doctor is going to attach a number to your diabetes, to your blood sugar level monitoring, then it depends on what he or she sees on your result. The severity of your glucose level. If your glucose level is too high, then he might attach a number to say, per day, check your blood sugar level number of times. Say, for instance, every 1 hour, or every 2 hours, or every 3 hours. Check your blood sugar level, and I want you next time when you are coming, I want to see the result. But if the severity of your diabetes is not all that bad, he can say, make sure you check your sugar level throughout the day without attaching any specific number of times you have to check it. So after 30 days, you may be able to check less often. So if for the first month, the severity of your blood sugar level is too high, he might attach a number. And when he sees that there's an improvement after the first 30 days, he might not reduce it. It's okay, check your sugar level just often, maybe 2-3 times a day, or once or twice a day. Because now there's an improvement from the first 30 days, and say, okay, now you are doing okay, so reduce it. So the first 30 days is critical when you are newly diagnosed as diabetes, if he or she is going to be more forceful in treating your diabetes. And everything depends on the severity of your diabetes and if there's any underlying illnesses. So that is why the first time you're diagnosed as a diabetic, the first 30 days is critical. The first 30 days is critical in the direction where your sugar level is going and how the doctor is going to handle the subsequent visit when you're around. So, however, if your blood sugar isn't well controlled, you may need to continue checking your blood sugar level frequently and not more often. There are two different things, frequently and often. So doctors are going to attach a number to say, okay, now from now onwards, you know what, I could see that your sugar level is getting too high. I want you to check sugar level frequently. Frequently, every 1 hour, check your sugar level. Before you eat, after you eat, bedtime, check your sugar level. And he wants to see the result the next time you come in. Okay, so this fourth question is very important to ask your doctor to give you a number of how often should you check your sugar level. Is very important. Okay, now let's go to number 5. Remember, I have 13 questions. I have to share with you guys 13 questions. Let's go to number 5. Number 5 are, what are some signs that my blood sugar is too high or too low? Remember, not everybody can interpret symptoms in their body. There are people that are good in interpreting symptoms in their body and deal with it straight away. And I've told you guys, as a diabetic, okay, as a diabetic, as soon as you have any symptom, treat it immediately. Treat the cause of that symptom. Don't allow that symptom to metamorphose to another thing. Okay, as a diabetic, once you notice any symptom within yourself, treat it immediately. Treat the cause of that symptom and get rid of it. Do not allow it to linger for a longer period of time because it's going to cause you more damages than good. So if you are not conversant with symptoms, ask your doctor, what are the signs that my blood sugar is too high or too low? And doctor is going to go through the list of the symptoms of diabetics when they are hypoglycemia or hyperglycemia. Okay? So some diabetes drugs drive blood sugar too low and can cause you hypoglycemia. Okay? And once your sugar level drops below the normal level, it comes with severity of damages. So doctors are going to let you know that this medication I'm giving you may or may not drive your sugar level low into hypoglycemia. Because there are some diabetes drugs that can drive your sugar level as soon as you take it, because it's supposed to reduce your sugar level to normal. But there are some that are very powerful that they are going to drive it even further down below the sugar level, and they start experiencing a severe symptoms of hypoglycemia. So doctors are going to go through the symptoms of a normal sugar level when it is too high or too low, and at the same time advise you that maybe this medication at times might cause you to have hypoglycemia experience by forcing your sugar level to go below the normal level. All right. So I'm not going to go through the symptoms, all of you, but those that are following me now know the symptoms of when sugar is too high or too low. So we're not going to go into that. Now, what are the symptoms of a low glucose level when you're experiencing hypoglycemia? Okay, what are the symptoms of hypoglycemia? We have heart palpitations. Okay, what do we have palpitations? When the rate at which your heart beats increases, abnormal heart rate beating. Okay, start when your sugar level goes down. Now we have anxiety. Okay, we have hunger, and then sweating. Sweating is the one that you can notice very well. Two symptoms that you can notice, in fact, three symptoms. When your sugar level goes down below the sugar level, when you're experiencing hypoglycemia, there are three noticeable symptoms you can notice. One is hunger, one is anxiety. You try as if you want to faint. You can't even stand. You're looking for somewhere to sit down. Okay. And again, sweating. Sweating is the one that you are going to experience forcefully when your sugar level is low, when you're experiencing hypoglycemia. Okay. This one, sweating, hunger, fatigue. The fatigue comes, you can't even stand. Your eyes are going to be turning as if you want to faint. You're going to be looking for somewhere to sit down when your sugar level deep down below the normal level, when you're experiencing hypoglycemia. Okay, so those are the symptoms of hypoglycemia. Once those drugs force your sugar level to go down, we have heart palpitations, when your heart rate beat fast. We have anxiety, we have hunger, we have sweating, we have irritability, and we have fatigue. So these are some of the symptoms we are going to experience once your sugar level goes down. Now, I've told you guys about, sorry, my team is playing soccer in the TV there, so that's why I see me, sometimes I push my head there. I could see many people are not watching. Many people are not watching. Many of you have gone. I could see all of you have disappeared. I'm talking to myself only. I could see everybody have disappeared. Who is there? Who? I could see everybody is no more there. All right. So let's talk about if you. Yeah, I know it's only two of you that is here. I can tell it's only two of you that is here. Yeah, I know it's only three of you. Selena, Carol, and Diane is here. It's only 3 people that are here, I can tell. Now, let's go to what if you have unresolved hypoglycemia. I've told you guys before, those that have been following me, that if you have unresolved you're welcome. Ayorinde, you're welcome. Now, if you have unresolved hypoglycemia, when your sugar level is too low and you did not treat the symptoms, I've told you guys how to treat that symptoms when your sugar level is too low. If you do not treat that symptom of hypoglycemia, it's going to be fatal. You might even lose your life. Yes, you can even lose your life. Do not allow symptoms of hypoglycemia to linger for even 5 minutes. Treat that symptom immediately, because you can even lose your life or even get stroke or heart attack or even death if you allow symptoms of hypoglycemia to linger for more than 5 minutes or longer. You can so treat that symptom. It's very easy to treat the symptom. I've told you guys what to do. Once the sugar level is too low, you check it is too low. All you have to do was grab something that contains sugar around you. If you see anybody selling something, Coke, anything, just take anything that contains sugar, drink it. While you are sitting down there, wait for 15-20 minutes, your sugar level is going to boost up and you're okay. That's how to correct it. Some have their insulin. The people who are dependent on insulin, they inject their insulin to boost their sugar level up. But the simplest way to correct that symptoms of low hypoglycemia is to grab there that you are sitting down, shaky, sweating, and you are sure that your sugar level is low. All you have to do was grab anything around you that contains sugar and take. Give it 15-20 minutes, your sugar level is going to be okay, and then you're ready to go. Now, if you fail to do that, okay, if you fail to correct that symptoms of hypoglycemia, as I said, you can even lose your life there while sitting down there. That's why you see some people, they just collapse and die, and they say, oh, somebody do a black magic for them. No, because you don't know what internally they are going through, or they keep ignoring it. Okay, so if you fail to correct that symptoms, you can experience clumsiness. You know, clumsiness as if you are intoxicated. Somebody who is intoxicated, drink a lot of alcohol, you know, you become clumsiness. Confusion comes in. Seizure. You see, when it comes to seizure, it means you are going close to 6 feet. When seizure start creeping in, that seizure, it means your organs are now shutting down gradually. Oxygen is no more reaching to the brain because you have low blood sugar. So your heart is beating too fast. It's not getting enough oxygen to the brain because the blood is too low. That is why you're experiencing seizure. Gradually, your organs are shutting down gradually. And the next thing, you lost consciousness. From that consciousness, you are saying goodbye to your loved ones until we meet again. So that is why you have to treat that symptoms of hypoglycemia. Do not allow it to last more than 5 minutes. As soon as you experience hypoglycemia, you show that your sugar level is low. If you don't have your insulin, if you're not dependent on insulin, or if you don't have insulin around you, grab anything that contains sugar around you and drink. Give it 15-20 minutes, you'll be okay. And that is what I've said to you guys. If you're a diabetic, or you have loved ones or kids that are diabetics, make sure before you leave home, like in your car, make sure you have something that contains sugar in your car. You know, in between the driver's seat, your driver and the passenger, in between the hole or in the here, there's a kind of sort of where you put something. Put a can of Coke or chocolate or sweet. Let it remain there permanently. You don't put it where you have to stretch to grab it. In between the passenger seat, passenger and driver, in between, that's where you put something there, or on the driver door. You know, there's a place you can put something there. Make sure you have 2 cans of Coke there or chocolate. Just leave it there permanently, because you might be driving and you experience hypoglycemia. You become confused. You can't see. You are shaking. All you have to do was gradually hold the steering of the car and move to the side of the road, park, and then open there and then drink your Coke. Or if you have somebody with you, just tell the person to open that Coke, open it for you, and give you to drink. But move over to the road if you are driving and wait, drink your Coke. Anything that contains sugar, within 15 minutes, you are good to go. The same thing if you don't own a car, if you don't have a car and you are using a public transport, make sure before you leave home, in your bag, women, don't be carrying all kinds of things in your bag and you're diabetic, but you forgot to have sugar, Coke in your bag. You know, in women bag, you can find things you don't want to see with your eye. And they're diabetic, but they will not have thing that is going to save your life. In that bag that you are carrying up and down, make sure you have at least chocolate, sweet, or a can of Coke in that bag. And if you know you're diabetic and you are leaving home, you're going to use public transport. So that in case you are in a public transport and your sugar level drops immediately and you can feel it, that you're losing consciousness, open that your bag and take a Coke and you'll be okay. Don't just go and fill your bag with all kinds of makeup and powder that is in the whole world, and then you forget to take and you're diabetic and you forget to have a Coke in that bag. Chocolate, anything that contains sugar should be in that bag once you are leaving home. The same thing if you have a child that is going somewhere or in school, you have to teach them how to correct that instance, and make sure they have something in that bag. Let the school know this is how to treat it. The same thing applies to your workplace. Make sure you have something that contains Coke in that drawer permanently. Do not take it. You can only take it in emergency when your sugar level drops. Then you drink it to correct the situation. So that is how to correct it. So we all know the symptoms of high and low blood sugar. I'm not going to go into it. Okay, that is number 5. So let's go to number 6. Let's go to number 6. Number 6 is, can you check my A1C level to see if my numbers have improved? Okay, your A1C level is done every 3 months, not every 6 months, not every 12 months. It is done every 3 months, your hemoglobin test. Okay, a real doctor that knows how to treat diabetes, you don't even need to ask your doctor, please, I need to do my A1C test. A doctor that knows how to treat diabetes, or a professional who has experience, knows that if he has a diabetic patient, he or she have to schedule appointment for the patient. So for instance, if you come to my office now, say you want to do today it's your day for appointment to do your A1C test. Once you come, I gave you all the requisition form to go and do your blood work. I'm also going to give you appointment for the next 3 months when to come back again. So as you are leaving my office to go and do your blood work, I'm giving you appointment when to come back again. So that's how you treat your patients, without even asking them, can you check my A1C level? So but sometimes doctors are going to forget. But you as a patient also, doctors see a lot of patients. It's also your responsibility to go and remind your doctor, I'm due for my A1C test. Please, can you give me the form? Let me go and do my test. Then the doctor is going to write the revision form for you to go and do your blood work. So make sure your A1C level is very important. It's an indicator of how well your blood sugar is controlled. Okay, A1C level is an indicator of how well your blood sugar is controlled. It measures your average blood glucose level over 2 to 3 months. Okay, so let me see. Esther, you're welcome. So your A1C, okay, your A1C, okay, your A1C is an important indicator of how well your blood sugar is controlled. It measures your average blood glucose level over 2 to 3 months period. In general, your A1C level should be 7% or less. However, your doctor may want it lower or higher depending on your age, health status, and other factors. It is a good idea to have your A1C level checked 3 months after starting treatments, and then every 6 months once you have reached your target A1C goal. For those that have been asking me, when do I check my A1C level? It is done every 2 to 3 months, but mostly it's every 3 months. Okay. And then the target range is 7% or less than that, but it can increase if depending on other factors, as I explained in there. Now, once you reach your target range, you might start doing it every 6 months, and that target range is going to take you about 2 years. You must meet that requirement for 2 good years for doctor to say, okay, now you're going to do it every 6 months. Okay, but normally it's an indicator. That is what doctors use, not what the one you do at home. Doctors use A1C level to see how he or she is treating your diabetes and how you are responding. That tells a doctor what is working and what is not working and where to improve your A1C level. Okay, so you must keep your target to 7% or less. But if doctor want it higher, there are other factors they may consider in terms of if there's any underlying illnesses. Okay, so that is number 6 question, why you should check your A1C level to see if my numbers have improved. Okay, now do you have any question? Let's go to number 7. Do anybody have any question? Let's go to number 7. Number 7, do I need to tweak my diet or exercise plan? Do I need to tweak my exercise or diet plan? Okay, both diet and exercise, okay, impact blood sugar levels. As I said, there are thousands of people that are not on medication right from day one, and they're able to live a normal life and they are controlling their sugar level perfectly. All right, so it's an option depending on the severity of your sugar level at the first time to see if doctor is going to give you this option to say, okay, your diabetes is not that bad, go on diet and exercise. But if it's that bad, doctor might insist that you have to be on medications and at the same time put diet and exercise. So when you say, do I need to tweak my diet or exercise? Yes, doctor is going to tell you have to change your lifestyle plan, because now that you are diabetic, there are reasons why you are diabetic. There are things you've been doing in the past, your lifestyle that is very bad, that now you are diabetic. So definitely your diet have to change. A lot of things about your diet have to change. And then if you are the type that have not been exercising, you will now involve exercise. Exercise plays important role. If you are persistent, somebody that exercise, you see a big difference in terms of your diabetes management. Okay, your numbers are going to be steady most of the time. It's going to be very hard for you to go for a test and see an elevation in your numbers. Exercise plays a vital role, and then dieting. Dieting also is very, very important. As we said it yesterday about dieting, you can drink as many medications you can drink, but if you are not dieting properly, eating healthy, balanced diet, it's a waste of time, because you have to learn to count your carbs. Those carbs are very important. Those carbs are what is making you very difficult in managing your diabetes. So dieting plays a vital role. You are going to tweak your dieting. Dieting, for sure, you have to change your diet. You cannot stay in the same diet you did even before. And I've told you guys about dieting. There are key factors in dieting. Before you are eating quantity. Before you are eating quantity, that is why you are eating a very big large food, like a Esther. If you see the kind of food Esther is eating, Esther eat a large food, but now she have changed it. So that quantity you are eating before, large food, no. Instead of large quantity, you are going to eat quality. So you will start eating quality, not quantity. The quality, I mean that your food has to be healthy, it must balance, and then it must have the required amount of carbohydrate in it. So if you don't know the amount of carbs in that food, you see that your sugar level is going to be high because you are still doing the wrong thing. So you have to identify quality, healthy, balance, and then know the amount of carb in that food. And I've told you guys, any food that does not have carbohydrate is not a balanced diet. Most of you are eating healthy food, but they are not balanced. You cannot be eating healthy food that is not balanced and you say you are doing the right thing. The food must be healthier, must be balanced, and then contains the right amount of carb for you to make sure you attain those target range for your glucose level. So that is why in terms of quality, because before you are eating quantity, now you have to eat quality. Then once you deal with quality, you have to deal with the size of the food you eat. Portion control, plate size. In the past, you can sit in your lounge and finish a bowl of food, all filled with carbohydrate, no vegetables, no fruit, nothing. Because of that large amount of food, too much carbohydrate, your medication is waste of time. It's going to spike up your sugar level. So now you're going to practice what is called portion control, plate size. You're going to eat in a smaller quantity at a particular time, at a given time. So the smaller the food, the smaller the carbohydrate, the better for you. So now instead of eating a large plate of food, you're going to streamline it to a smaller food every 4 hours. So that is what is called portion plate control. Smaller food every 4 hours. The time for you to eat one big bowl of food is gone. It has to be small. Then once you are dealing with, after you finish dealing with portion control and plate size, you have to deal with what? Timing. At what time did you eat? The time you eat plays a role. So, because it has to work with your carbohydrate, your carbs. So, for instance, if you eat 7 o'clock, your breakfast 7 o'clock this morning, you've eaten the right amount of healthy, balanced diet with the right amount of carbs. Like every meal must have 15 grams of carbohydrate. So, for instance, if that food, that your breakfast contains these three things, 7 o'clock in the morning, you know you're not going to eat anything till 4 hours after. Because if you eat anything before 4 hours, it's going to alter that carbohydrate that is in that initial food and then spike up your sugar level, and then you are back to 0-1. So once you eat that food at 7 o'clock, you have to wait till 4 hours after that food to eat another food in a smaller quantity so that it does not alter the first food you eat. If you have to eat in between that 7 and 4 hours, you have to take something like fruit, orange juice, apple, one orange. Not orange juice, oranges, the one you get in the tree. You peel it, you take one to keep you filled up, or one apple, or a snack, or a salad. Okay, in between. But you cannot eat any other food until 4 hours after. Because if you eat any other food heavier before 4 hours, it's going to alter that your carbohydrate intake and the spike of your sugar level. So once we eat, you have to be disciplined. Not when your friend come with granite, you say, oh, let me have one granite, you eat. That granite contains carbohydrate. One of your friends come again, say, oh, I have a almond. You say, oh, give me that almond. You take almond and eat. That contains carbohydrate. Another your friend come again, say, oh, I have plantain. Oh, bring that plantain, you eat. You just finish eating 7 o'clock. Already you've eaten 3 different types of food. Those food contains carbohydrate. So already it has increased that 15 grams of carbohydrate to over. Now you see that the symptoms of peripheral neuropathy, diabetes start coming. You start feeling pains and numbness in your feet because the sugar, your carbohydrate now has increased. And then you start feeling those pains on your feet, burning sensation, tingling, and all those things. And then you go to tell you, say, oh, why is it that my sugar level is always high? I'm taking medication because you've not mastered the art of dieting. So timing plays an important role. So these are the things why you have to tweak your dieting, and then exercise is very important. You have to be physically active. You have to be physically active. If you are not used to exercising, then you have to start exercising, because exercising plays a vital role on why your sugar level is in there. So let's go to number 8. All right. Do we have any question? None of you saying anything. Everybody's quiet. Number 8, can I have my cholesterol and blood pressure level checks? You see, I've told you guys in the past, once you are doing your A1C level test, every 3 months, make sure you check your kidney and liver and your cholesterol and your blood pressure. Your blood pressure is checked every time you visit your doctor's office before he starts talking to you. So he takes down your blood pressure. Who are you? Yesterday, did anybody watch my program, the live program we did yesterday? I believe you guys watched. Who was there? I think you see one of our fans. You see one of our friend here that has CKD, that is in stage 5. We discussed it yesterday. He was with us yesterday, telling he's in stage 5. He will need a kidney dialysis and a kidney transplant because of uncontrolled sugar level, diabetics. I don't know, you guys watched yesterday program we did. The guy was with us yesterday. And I've told you guys, and once you are doing okay, welcome. So once you are doing your A1C test every 3 months, okay, once you are doing your A1C level every 3 months, make sure you pay that extra money to check your cholesterol, check your kidney, check your liver, and do your cholesterol test. If possible, do your potassium. These are very, very important. If you guys go and watch yesterday's video we did, live video, you see the guy, one of our fans here that is on stage 5. Definitely, he's looking for kidney transplant. He has CKD and lupus also. All right, because of uncontrolled diabetics. If you don't control your diabetics, you're going to have in the same situation. So I encourage, if you have a good doctor, if you're in a good hands, doctor is going to be checking those 2 organs, liver and kidney, every 3 months to make sure it is not being attacked by your excess sugar. And also your cholesterol is very important. Check your cholesterol. That has to do with your cardiovascular areas. So that you make sure that you have a good cholesterol, so that you are free from stroke or heart attack or even death. Your blood pressure also matters a lot, so that you don't become hypertensive if you are not already hypertensive, because diabetes can cause you to be hypertensive if you don't control your sugar level, and also cause you to have a bad cholesterol. So that is why you have to check all those things, your cholesterol and your blood pressure, and also check your kidney and liver every 3 months. Okay, maintaining a healthy blood lipids. When we talk about lipids, we're talking about fats, and blood pressure levels is important part of any good diabetes management plan. Okay, now diabetes lowers good cholesterol. Okay, diabetes lowers your good cholesterol, which is your HDL, high density lipoprotein. Okay, and then increases your bad cholesterol. I've done that before with illustrations. And then triglycerides. Okay, so high blood pressure is common in people with diabetes and can increase the risk of some complications. So hold on, let me share this with you guys so you guys know what I'm talking about. So this is what I was trying to say. Okay, maintaining a healthy blood lipids. When we talk about blood lipids, we're talking about fat, and blood pressure levels is an important part of any good diabetes treatment. So diabetics lowers good cholesterol. Your good cholesterol is the HDL and increases your bad cholesterol, LDL, and triglyceride. So high blood pressure is common in people with diabetes and can increase the risk of some complications. Okay, so that is why you have to. I'll be right back. Just a minute, please. I'll be right back. Sorry. Sorry, I don't know. I'm reacting to something. So I was saying before, I shared you guys this about checking your cholesterol level. Now, I was checking your cholesterol. Now, make sure it is important you check it. Okay, make sure it is important you check it. I'm gonna say something here now. Just hold on, let me see. To keep your cholesterol level in check, your doctor may prescribe a statin as part of new diabetes. So add medications. Statin to make sure. Okay. So now, let me see what am I seeing here. To keep your cholesterol levels in check, your doctor may prescribe a statin as part of your new diabetes treatment. Your doctor may also add medications to manage your blood pressure. Ask your cholesterol ask to your cholesterol levels. Check at least 3 to 6 months after starting treatment to make sure they are tracing in the right direction. Blood pressure levels should be checked at each doctor's visit. Okay, so now check your cholesterol. Okay, also make sure you test the functionality of your kidney and then your liver. Now, when we are talking about how can diabetics cause you to have lower your cholesterol? Sorry, I'm gonna take my medication. All right, just a minute. I'm gonna take my medication. So let me take it. I'm having a reaction now. Let me take my medication. All right, I'm having a reaction, so I need to stop it immediately. Now let's see how your diabetes can cause you to have lower your HDL. Your HDL is your defense in your cardiovascular. I've done several video on it. Let's use this. I'm going to use these two remotes. Let's assume this is your sugar level. Now, this is your normal sugar level here. Let's assume this is your normal sugar level here. Okay, I'm going to put it in the color of my t-shirt. So your sugar level is level at the corner of my t-shirt here. All right. Your LDL, the low density lipoprotein, is your bad cholesterol. LDL is your low density lipoprotein, is your bad cholesterol. Your LDL is going to be at the bottom here, somewhere at the bottom, out of visibility. So anytime your sugar level is normal, here your HDL, which is your good cholesterol, is going to be in the same level with your normal blood sugar level. All right. Your good cholesterol is your defense. Anything that has to do with your heart, your cardiovascular. Okay, because there are no blockage in your arteries. The blood is pumping to the arteries, flow normal. There's no issue. So your HDL and then your normal sugar rate is going to be normal. So you are okay. You shouldn't be worried about stroke or heart attack or death because your HDL is normal. Both your sugar level is normal, your HDL is normal. Now, if your sugar level, you see my sugar level normal is here. If my sugar level comes to the chin, to my chin, that is rises high. Remember, my HDL is normal here before, but because now my sugar level has risen above this, it's going to force my good cholesterol HDL to come down and then bring that bad cholesterol to be in the same high sugar level. So now you have bad cholesterol leveling with your high sugar level. So you have two potency, two dangers within yourself. So when you have high sugar and the bad cholesterol LDL in the same position, that is when it becomes dangerous to you. You can have heart attack, stroke, or even sudden death. Because now the bad cholesterol have forced the good cholesterol, which is your defense, to go down and then come up with the aid of triglyceride. So that is why how diabetics cause you to lower your good cholesterol and increase your bad cholesterol up. So in order to make sure you don't allow this bad cholesterol to come up and force the good cholesterol down and expose you to sudden death or heart attack or stroke, all you have to do is to make sure your sugar level is normal at all times. Now, since your LDL, which is your bad cholesterol, and your high sugar is in the same height, and then your good cholesterol has come down, the only way to correct it is to bring down this sugar level back to where it's supposed to be, the normal. As soon as your sugar level comes down to normal, it's going to force your bad cholesterol to come down and then bring up your good cholesterol to be where they're supposed to be, and then you are okay. With the help with the aid of triglyceride. So that is how it works. That is how, if you read what I just put before here, let me see. Okay, if you read what I just put here, if you read this one here, it says maintaining a blood lipid and blood pressure level is an important part. Okay, so blood lipid is maintaining good cholesterol to make sure your good cholesterol, and then your blood pressure levels is important as part of a good diabetes treatment plan. Diabetes lowers good cholesterol. See this good cholesterol, it lowers it down and then increase your bad cholesterol, LDL, and triglyceride up. Okay, so that is how it works. So in order to make sure that your bad cholesterol remains permanently at the lower end, make sure your sugar levels, the same thing applies to your high blood pressure. If you constantly have a high sugar level, it's going to force you to become hypertensive. That's all of a sudden you become hypertensive because your sugar level is too high. So in order not to be hypertensive, you have to make sure that your sugar level is normal at all times so that you avoid being hypertensive and don't be on medication. Otherwise, you're going to be having diabetes, hypertension, and bad cholesterol. And the worst thing is that if you become hypertensive, you're going to be taking that drug for life. The same thing applies to cholesterol for life, the way you are taking your diabetes medications. Okay? So that is how it works. All right? So to keep a good cholesterol level in check, your doctor may prescribe a statin as part of your new diabetes treatment. So if you have a bad cholesterol, it's going to prescribe you medication, or if you become hypertensive, it's going to prescribe you medications to control your bad cholesterols, to open up the arteries, okay, and at the same time to control your high blood pressure. All right. So that is why you can ask your doctor if I recommend you to be checking your cholesterol and your liver and your kidney every 3 months you go to do your A1C test. So let's go to number 9. Let's go to number 9. Number 9 says, can you check my feet? Okay. Can you check my feet? Okay. So ask your doctors to check your feet if they can. Normally, doctors always check your feet. Once you visit them, they do a free physical examination. They take your weight, they check your height to see if you are reducing your weight. They check your height, and then they take a look at your feet to make sure there are no cuts and blisters. Okay, remember your feet is very important for you not to be amputated. If you don't control your sugar level, okay, it can lead you to have a peripheral neuropathy, damage your nerves and arteries, your blood vessels, and if you have any wound in those areas, there's no healing because of your persistent sugar. There's no healing in that area until your sugar level is stabilized. Okay, so always ask your doctor once you visit to check your feet. And if you are checking your feet at home, don't just check your feet. Check your feet up and see it's okay. Put a mirror on the floor. Put a mirror on the floor. Put your feet in there and see underneath to see. Make sure there are no blisters in it. Or if you have a son, a daughter, a husband, a wife, let them check your feet. All right. Also, in between your toes, don't just look at it. Put your finger in between your toes to see, because there may be some rough or cut that you cannot see. So put your fingers in between your toes to make sure you are not feeling anything that is not supposed to be there. And also, make sure when you are cutting your toes, you don't cut the skin so that infection cannot penetrate through in there or expose you to a wider wound. So ask your doctor to check your feet to make sure that your blood is circulating properly in those areas. There are no blisters or cuts or any foot ulcer developing that you might not even notice. Okay, so that is why ask your doctor to check your feet. So I'm not going to explain too much on that. We've discussed that before, so you guys know what I'm talking about. Let's go to number 10. Let's go to number 10. Will I ever be able to stop treatment? Okay. Will I ever be able to stop treatment? You in the number 10 question. Selena, what is yes, please? Can you explain? You say yes. I don't understand what you mean by yes, please, Selena. So number 10 says, will I ever be able to stop treatment? Okay. So treatment, in terms of you stopping treatment, depends on if you help yourself. I put it this way: if you help yourself, then doctor might be able to help you. So you see, that is why I put it towards the end. It's not. I didn't put that question at the beginning. I put it towards the end. Everything depends how you handle your treatment right from day one, as it is progressing. There comes a stage. The numbers communicate to the doctor and even you. When you go for an A1C test and you see your numbers looking good, when you go home, you'll be happy. When you leave the doctor's office, you'll be happy that things are falling in place. It's a matter of time. I will stop this medication. Okay, all right, okay. So that is why I put this question towards the end, because you're not going to ask it at the beginning. Numbers communicate to the doctors. The results communicate to the doctors and also to you. Because when you go and do your A1C test, okay, and then you are checking your blood sugar at home, when you check, you see the result, and it becomes consistent that the number is, you are going to be happy. When you go to see your doctor and the doctor say, you know what, I'm impressed, you are going to leave that doctor's office happy, because you know you put a lot of hard work right from day one. You took your treatment seriously. You want to be alive for your family, and you are doing the right thing. So that is going to give you more energy to continue doing what you are, because this is working. you are not feeling any complications, all your organs are okay, you are healthy, you are not falling sick today, tomorrow, every day you are falling sick. No, you are still doing the normal things other people are doing. So there comes a time, 1 or 2 years down the line, even before you even ask this question, doctor can say, you know what? I'm looking at the numbers. Do you still want to be on this medication? Because you don't need it. I'm looking at your numbers and your record. You're looking good. That is when doctors start discussing with you. Okay, it's, you can choose not to. I can stop this medication now so they can handle it with diet and exercise. So doctors are going to go through with you the process you have to follow in order to stop treatment. You are not the one to recommend stopping treatment. Doctors are going to recommend when the time is right. As I said, you must have a clean A1C record for 2 years minimum for doctors to have the record to strike you out of medication and say, now you can go and do dieting and exercise. You must have a clean, stable record for 2 years where your sugar level has never risen or fall below the line. For doctor to say, you know what, your diabetes is in remission. When we say it's in remission, reverse does not mean it is cured. It means your diabetes have stabilized. Okay? But that does not mean it's cured. It cannot be cured. It means it has been sent into remission, reversed, stabilized. You don't need medication anymore. But you still have to handle it as diabetes. Those things you are not supposed to eat, you can't go back to them anymore. You still have to keep doing whatever you are doing. You can't go back to what you are doing before and start eating anyhow, drinking anyhow. No, you still have to stick to the rules and regulation. But this time around, is that you're not going to be on medication. You're only going to handle it with dieting, exercise. Okay? So that is it. So let's go to number 12. No, I mean number 11. Sorry. Number 11. So number 11, should I have my kidney function checked? I think I did say it. I did say it in my when I was talking about cholesterol. Okay. Yes, check your kidney, check your liver, and check your cholesterol. Those 3 things. Every time you are doing your A1C test, make sure you check your kidney, check your liver, and do your cholesterol test. Okay. Uncontrolled blood sugar level may lead to kidney damage. Yesterday, one of our friend here, those that are watching yesterday's program live, one of our friend here is on stage 5. He'll be needing kidney dialysis and nobody to donate any kidney for him because of uncontrolled diabetes. Okay? So keep an eye on your kidney and liver and also make sure you check your cholesterol. It is a must. Pay that extra money, okay, to make sure you are keeping an eye on your kidney and liver and do your cholesterol. Because those are the 2 vital organs. Those are the 2 vital organs diabetes tend to destroy early so that you don't live long. And I've said to you guys, once you have a kidney damage, it's not something you can go to the shop and buy. You have to look for a donor. And if you cannot find a donor, it means you will have one-way ticket to your grave. Okay? So, as I said, keep an eye on your kidney, liver, and do your cholesterol test every 3 months you go to do your A1C test. It is very, very important. Uncontrolled blood sugar may lead to kidney damage. A few months into the new treatment, it is a good idea to have your doctor order a test to check your protein in your urine. If the test is positive, it indicates your kidney function may be compromised and your nutrient may not be working well. Okay, so that is why you have to make sure you check your kidney. Check your kidney. Okay, so that is why you have to check your kidney. So number 12. Number 12 is my final takeaway. All right. Do you guys have any question? Because number 12 is my final takeaway or thought on what we have just gone through. I'm going to round it up with my number 12 and number 13 because in my I told you guys I have 13. So I added 12 and 13 as one, as my final thought. So do you guys have any question? Okay. All right. Now, the floor is open for those who want to ask questions. You are free to ask your question now. Okay. Now, if you have diabetics, okay, and this is your first time to take a diabetes treatment plan, okay, it is unique. You have a good relationship with your doctor. Listen to your doctor. I'm adding 12 and 13 as my final thought. After asking all these questions, what are your obligations to your doctor? You have an obligation as a patient, one, to listen to your doctor at all times, follow doctor's advice and prescriptions plan. It is important. Never you compare your treatment with your friends to your doctor. Doctors don't like it. When you come to their office, say, oh, another doctor prescribed my friend this and that, this and that. Doctors don't like it. Doctors, every doctor have the way they treat their patients individually. If you have trust in your doctor, follow their treatment plan. But do not compare doctors with another doctor or try to jam their head. That is why, for instance, go and take a medication from another doctor and go to your doctor and give that doctor, I want this medication. Can you write it for me? And see what doctor is going to, how doctor is going to have to handle you. Go and get a medication from another doctor and say, doctor, I want this medication. Just and see how the reaction of that doctor towards you. You'll not like it. He might handle it professionally, but right from that day, you might not be getting the same treatment you are getting before. Gradually, he's going to lay you off and ask you to go and look for another doctor. Okay. One, you destroy that trust and relationship with him or her once you start bringing another medication from another doctor to give you. That trust and relationship is dented. But he's going to handle it professionally and gradually lay you off and ask you to go and look for another doctor. If it's a doctor that you can call within a short period of time and he give you audience to come, some doctors will tell you, oh, you can't come the following day. But there are some doctors, due to the relationship and trust you build with them, you can call him at any time. It's okay, come into the office, and then, or maybe your son or your daughter is sick or your friend is sick, you can bring that person and they write a medication for them. Okay. But if you tend to go that way, you see that first of all, those trust and relationship will be broken. Then gradually, doctors are going to lay you off professionally without offending you and still be within their right because you've crossed that line. So what am I trying to say? You must listen to your doctors at all times, follow their instructions, their treatment plan. They are free to answer your questions. If you are confused in any medications, ask your doctor your question. Even make an appointment to come and then clarify certain things you are not clear with the medication you are having. Okay. Doctors like patients that are attentive to instructions and then follow their guidelines. Okay. So if you want your diabetes treatment to work and to be unique, tailored to you, is follow their instructions and do what they ask you to do. Diabetics, as I said, is something that's peculiar and chronic, but you can live a normal life if you follow those conditions being given to you and then abstain from those things they ask you not to do and continue doing those things they ask you to do. All right. So if this is your first time as a diabetic, these are certain important questions you are free to ask your doctor to have a clarity on how to handle those situations. Because in the beginning, it is tough, confusion, and then shock because you don't know where to start with, especially on the dieting aspect and then the exercise. Because I know a lot of people don't like exercising, but once you're diabetics, you have to bring in those things to help your life. So what I'm trying to say in essence is that attentive to instructions is very important once working with a doctor, and then clarity to questions are also welcome by doctors. You must ask your questions. If you are confused, feel free to ask questions and get a clear advice on what and what not to do. So that is why I said in my final thought, questions to doctors are critical and very important. It means you are following them, you are listening, you are confused, you ask questions, and you get clarity on what to do. So if you are confused, if this is your first time as a diabetes and you've been diagnosed, do not shiver. Do not be overwhelmed. As a matter of time, you know that you be conversant with the things you were expected to do, and then you see it becomes easier at later stage. Okay. So do you guys have any question? I'm waiting for questions. Do you guys have any questions? Now the floor is open for questions. Because we're almost 2 hours here now, so we are about to round up. Questions? And for those, I did share, if this is your first time, let me repeat it again. Now, Managing Diabetes is on TikTok. Okay, go to TikTok. Go to TikTok. Okay, go to TikTok and use this name on TikTok, Managing Diabetes, and then follow me on that page. Now this is, I will see, you know, because there are people, I know my followers that are with me all through. They are dedicated. They are with me all through. They are with me on the other page. They follow me consistently. So if you are dedicated, okay, if you are dedicated, a serious follower, you would like to follow me and go to my TikTok page and then follow me on that page also. All right, because I'm dropping new videos there also, so you can follow me on Facebook, YouTube. I'm on Instagram also, and then now we are on TikTok. All right, to reach more wider audience. So my dedicated followers, because there are some followers here that are not dedicated, you only see them once in a while, or when they have a problem, they come in, ask the questions, and then you see them again. But I know my dedicated followers, they are with me all the time. So those that are dedicated to this page, go to TikTok, okay, Managing Diabetes, and then follow me on that page. All right, just go there, follow me on that page, so that when I drop a new video there, you also be notified. I'm trying to add it so that when I do a live video like now, it's also going to be streaming on TikTok. I've not yet finished setting it up. So hopefully by next week, I'll be able to finish setting it up. That I also live stream the way I'm live streaming, so that you can also watch me on the TikTok. Like when I'm streaming now, you can watch me on YouTube live, and then 2 of my pages on Facebook. So now I'm trying to add TikTok and Instagram to my live stream. So I'm working towards that. So those that are dedicated to this page, go to my TikTok page, Managing Diabetes. That is it there. If you go to Managing Diabetes on TikTok, you can now follow me in there to get a wider audience. Okay. So thank you in advance for those who will go and subscribe and follow me on TikTok. Thank you in advance. All right. I will see those that are following me there, because once you join me there, I'll see. I know my dedicated followers. Once you join me there, I will know who and who is on that place. So do you guys have any question now? Do we have any question? The floor is open for question. Before we go, we only have about 5 more minutes to go. Do you have any question? Okay, go ahead, Rabina. I'm waiting for your question, Rabina. All right, Regina, you're asking me, you see all my response? All my response there, wheat and oatmeal are complex carb. They are good, all right? Once eaten with moderations. Remember, they contains a little bit of carbs, carbohydrates, so you got to eat them in moderation, but they are complex carb. They can't spike up the sugar level because it's very hard to be broken down. So oatmeal is okay. Oatmeal is okay. Wheat is okay. Grain is okay. Now on your C peptide result 1.5, 1.5, 1.45 is okay because C peptide result is they use it to test the sample of blood or urine, okay, to see if there's any insulin presence in your urine. So they use C peptide result to measure the level of sample of your blood, or they take sample of your blood or your urine, okay, to measure accurate way to find out how much insulin your body is making. Okay, they use it to find out how much insulin your body is making. So now at 1.45 is okay because your C peptide result range is supposed to be between 0.5 to 2.0 monogram per milliliter, or 0.2 to 0.8 per nanomole per liter. So at 1.55, you are still okay because the normal range is between 0.5 to 2.0 nanogram per millimeter, or 0.2 to 0.8 to nanomoles per liter. So you are still okay. At 1.45, it's still okay. So when the doctor requires a C peptide result, is to find out, to measure how much insulin your body is producing or making, okay? Because you need insulin to regulate the amount of sugar level in your bloodstream. So at that range, 1.45, you are okay, all right? You said, I want my diabetes go away from diet and exercise. Well, if you are serious with your dieting and exercise, your diabetes can go into remission. It can go into remission, but that does not mean it has been cured. It's not going to go away permanently. No, you can send it back into remission, whereby it's not going to cause you any more complications, but that does not mean it is cured. Okay, but you can reverse it, send it into remission, but that does not mean it's going to go away. No, it can't go away. You cannot cure it. Azuma, you are welcome. Good afternoon. You came late. Azuma, you came late when we were about to close. How many grams of carb I must eat in a whole day? In a day, you have to eat 60 to 65 grams of carb. Robina, you have to eat 60 to 65 grams of carb. You have to eat 60 to 65 grams of carbs per day. All right. Sorry, I made a mistake. Not 95. Sorry, I'm going to correct it. It's not 95. It's 60 to 65. Beverly, you're welcome. I'm going to remove this. It's wrong. It's 60 to 65. Sorry, I'm going to remove it. Okay, I'm trying to remove it. Yeah, 60 to 65 grams per day. 60 to 65 gram per day. All right. And then per meal, you have 15 grams per meal. You have 15 grams per meal. Okay. You asked me per day, I give you per day. You asked me this is this, I gave you per day and per meal. They are two different things. This is per day. This is per day in a whole day, 24 hours. This is what you are supposed to, okay. Per meal, each time you eat your carb is supposed to be 15 grams of carb. Okay, 15 milligram per meal is 15 milligrams of carb. Yeah. All right. I don't know what you mean by electric device. What electric device? I don't know what you mean by electric device. I don't know what you mean by electric device. Mobile. What is mobile? How can mobile raise your blood sugar? Can you tell me more? How can mobile raise your blood sugar? Can you tell me more? Can you tell me more how mobile raise your blood sugar? When you say mobile, I'm confused. When you say mobile, so that's what I'm trying to understand. When you say use mobile in 3 hours continuous, are you using CGM, continuous monitoring system? There's something we call CGM, continuous monitoring system. Is that what you're using to monitor your blood glucose level? There's something we call CGM, continuous monitoring system. Is that what you're using? Well, I don't understand what you mean by mobile. Raises blood sugar. That's what I'm still confused. What do you mean? You say you use Facebook. So how can Facebook increase your blood sugar level? That's what I'm trying to figure out. Because you say using electric devices raises blood sugar level, and I say, what do you mean by that? You say mobile, and then you say I use Facebook. So does Facebook make your sugar level to go high? Is that what you're saying? Well, I'm hearing it the first time from you. Maybe I have to research on it. I'm hearing it the first time on you, Rubina. So maybe I have to make a research on it to find out. So are you going to sue Facebook? Maybe you have to sue Facebook for making your blood sugar level to go high. Try to sue Facebook, sue them to court so that they will pay you for using their Facebook, and it increases your sugar level. All right. Okay. Good luck. When you get the money, let me know. You're funny. Robina, you're funny. All right. Okay. Do we have any more question apart from Robina that is making us laugh? See Francis here. Francis, are you still there or you've disappeared again? Let me see. I think Francis came in. See Francis here a while ago. Beverly. Okay. I didn't know. You see, I didn't know that you asked a question. Francis says, please, can you confirm the effectiveness of stem cells medications for the treatment of diabetes? We're in a patient of diabetes. No, I'm not going to recommend it. As a matter of fact, I was reading something online yesterday. People going to Turkey to do a surgery on the stem cells surgery to get their diabetes cured, and I was just shaking and laughing. Okay, in Turkey yesterday, I saw it. They advertised it on Facebook. People to go in Turkey, they can do a surgery on the stem cells and then cure your diabetes. And they are charging a lot of money. I think they are charging almost close to $100,000 for the treatments. So I was just shaking my head, So I wouldn't recommend it. There's no effectiveness for it. So don't even waste your time. By the way, you're going to put your life in danger, because even though I see them on yesterday, I was going through it yesterday. So on Facebook, they advertised it in Turkey, 100,000 for the surgery. But at the end of the day, by the time you pay that money, you're going to sign a waiver that in case if you lose your life, do not sue them to court. They are not liable. So there's a waiver you have to sign. So if they are sure that if you do a stem cell surgery and it's going to cure that diabetes, why are they asking you to sign a waiver that something might go wrong? Something might go wrong in the surgery. So why are they asking you to sign a waiver that something might go wrong? But you want to collect my $100,000 to do a stem cell surgery, and at the same time, I'm going to sign a waiver for my family not to come after you if something goes wrong. So you see that something is not adding up. So I'm not going to recommend the stem cell. I've read about it, but in the medical journal, in the medical history journals, the stem cell cannot do anything. And in Turkey, this is happening in Turkey. Every country have the way they regulate their medical associations, but it was in Turkey, not here. And that can, even in India that have a medical tourism, I haven't heard about stem cell to correct diabetics with stem cell. Even in India, where they have medical tourists, most people go for their medical seek medical attention. But this one was in Turkey. So I've read about it, but I cannot recommend it to you. I wouldn't want you to go and waste your money to go and do a stem cells. And the reason being, let me just tell you the reason being. For instance, you have $100,000, and maybe that is the last amount of money. You've been working for years to save that money, and then you want to go and spend that money, give it to a medical organization that is going to ask you to sign a waiver it's not 100% guaranteed. Anything can happen. So you collect my $100,000 that I've been saving for years, and then my life is not even guaranteed, and I might even wake up. You might even complicate the issue after the surgery. So why I say I cannot recommend it is that I used to give this examination. I used to give these examples. There are head of states. When I say head of state, presidents of a country, these are people that have billions in their accounts. There are A celebrities in Hollywood. There are musicians that are A celebrities that are diabetic. They have all the money on earth. $100,000 is just a peanut. It's just something they can use it and give it. They can use $100,000 and just use it to wash a car because they have billions in their account. So if these people have those kinds of money and there are stem cells that can cure diabetes, why wouldn't they go and do it? Why wouldn't they go and do it? I'm talking about president of states, A celebrities that have the money. So why wouldn't they go and do stem cell? They know they have good medical doctors, professionals. Why wouldn't they go and do it? So why would you go and use your hard-earned money to go and give a medical association that is going to ask you to sign a waiver to do a stem cell? So don't waste your time. So I'm just giving you the comparison. Okay, there are people that have the money, the means. $100,000 is just something they can just. It's just a peanut to them, and there's a stem cell to correct it. Why wouldn't they go and do it and be free? Why would somebody come to tell you, okay, give me $100,000, I'll go to do stem cell. So you should add 1 + 1 and know something is not right. Diabetics has no cure. No cure. You can send it into remission. You can reverse it, send it into remission, and then be free from all the complications and live a normal life. But there is no cure. Even the surgery itself is just a waste of time. People go to surgeries to do stomach liposuction sock, and at the end of the day, they are okay for the first 2 years. The next thing, after how many years, they fell sick and they die. It's like those people that are increasing their buttocks. You go and do buttocks surgery. Yeah, you might enjoy it for 1-2 years. Do you know what is going to happen 3 years along the line? You do it now to increase the size of your buttocks. You are feeling happy. What happens 4-5 years along the line? You start seeing the repercussion. So, Francis, I cannot recommend it. If you have your money, please use your money and do something wise. But just follow the simple rules. Okay, follow that simple rules. That is not going to complicate issue for you. You might go and do that stem cell surgery now. You look good. Maybe you are lucky to come out of it. You look good. You look good. You look good. What happened 2-3 years along the line? You start seeing the repercussion. That might be not effective. You see that it become worse, or you develop cancer from it because of the things they use in there. So our advice is just leave it the way it is. Okay, so don't even waste your time on that stem cells. But if you have too much money, you want to spend, we can do a crowdfunding for some people that need a kidney transplant. You can use that money to give them to go and look for kidney transplant. So I wouldn't recommend it for you, and then stay away for you. I've heard about it. There's nothing good about it. Just a waste of money. Okay, that's my own candid advice. So, but you have the final say. It's your money, so you have the final say how you spend your money. So that's my advice, Francis. Are you there, Francis? Okay. So do we have any other question again? Do we have any other question? Do you have any other question? Oh, we call it a day because it's almost over 2 hours now. So if you guys don't have any questions, I'm going to let you guys go. And then tomorrow's Sunday, we're going to meet again. Keep watching the videos. Once again, please kindly go to the TikTok page and subscribe. Those that are my dedicated followers. You see, so why all these plant medications? When you talk about plant medication, what are you talking about? Are you talking about herbs? Are you talking about herbs or what? I need a more clarification when you say plant medications. Are you talking about herbs? I need more clarifications to answer your question. You say plant medication, so I don't know what you mean. Are you talking about herbs? All right. Well, while I'm waiting for you to clarify let me see what it says. I've on the herbs, the same thing applies to the herbs. Okay. You cannot mix herbs and medication the same time. It is not visible. It's not advisable. I've told you guys about the pros and cons of using herbs as a source of your medications. Now, your medication, the medications you get from doctor are medically, scientifically approved. It goes through a rigorous process. There are multi-million-dollar companies that manufacture drugs. They don't just go and manufacture drugs and put it out in the market. It takes years and upon years to get approved. It goes through series of tests before the FDA, Federal Drug Law Enforcement Agency, approve it to be sold to the market, to bring it out to the market. It goes series of testing and approval process. And once FDA put their stamp of authority on it, is a guarantee that this medication does what it says it does. And it's not going to be harmful to your health. Now, those drugs, those companies, these are multi-million-dollar companies. They won't. It's a brand. If anything goes wrong with that drugs, you have every right to sue that company and even sue the government for authorizing those drugs to be sold in the market. So no brand, those companies will not like to destroy their reputation by selling drug in the market that is going to be harmful to patients. Okay. Now, in terms of herbs, okay, herbs does not go any approval process. Somebody goes in the farm and get some leaves, go to the back of the compound there, put everything together, put it in a plastic bag, seal it, and put a company name there and sell to you without even anything going through approval process. Now, you don't know the content of what you are taking as herbs. Most herbs are going to cause you more harm than good. So, because remember, I told you guys, everything you take have to be filtered through the kidney. So those herbs might be so strong to the kidney that it's even going to cause more harm to the kidney and the liver. And by the time you know it, you are back to the hospital and you'll be needing kidney transplant because of the efficacy of those herbs are not good for your health. There's no any approval process. Just one man, a husband and a wife, go and open a small, because I know leaves, and they go to the farm, pick up leaves, and tell you, oh, if you drink this, it's going to solve this, and then you are giving them their money, They want to get rich overnight while you are selling something that did not go any approval process. Now, if you drink those herbs and fall sick or somebody die, who are you going to hold? You can't hold anybody because government did not approve it. Now, if I believe that these herbs is going to be helpful to diabetics, and I have gone through the process, if I believe that I have found a herb that is going to be beneficial for diabetics, do you think I'll be selling it on the street? When there are multi-million-dollar companies that I can go there and sell them my royalty and be a billionaire overnight. Once I can prove to them that this leaf can help in managing diabetes, I will look for a multi-million-dollar company or go to the government and say, government, I have something for here. Can you guys back me up to open up a pharmaceutical company and produce it in a large quantity where it can be verified and approved and be sold to the market? Okay, so if I have a herb that can do those, it's either I go to those multi-million-dollar company and sell them my right and get royalty and become billionaire overnight. Once I have every documentation to prove it to them, or I will go to the government and say, government, I have this. I'm an indigenous of this state. Can you back me up with money to enlarge it? And we'll go through the approval process. So why would I have something that cure diabetics or hip diabetes and I'm doing it at the back of my compound? And then in the next day, I'm in a bus or in the market selling them one by one. Does that make any sense? So it doesn't make any sense. So those herbs are not good for you. You cannot mix traditional herbs with medical drugs. Okay, traditional herbs are going to be more destructive to you because they did not go any scientific approval. It's just one person that mixed something and give you, and once you are drinking them, it's going through your kidney. Maybe it's going to be too strong to your kidney or liver and damage it. So except those herbs that have gone through FDA, government have approved it and put their stamp of authority on it and say, then you can go for those herbs. But those herbs are sold by one person and all these things, traditional medicine, stay away from them because it's going to cause you more harm than damage. All right, so that's my simple advice on herbs. All right, Francis. Okay, we are going to round up now. Let's round up. It's time for us to go. So today, those that are joining us late, I'm going to just go briefly, just within 1 minute or 2 minutes, and then we'll finish it up. All right, those that are joining us late, I'm going to do a quick rundown to what we discussed today, and then we'll go. Today, we discuss, this is the topic of what we discussed today. What we discussed today. Important question to ask your doctor after you start taking you start a new diabetic treatment. That is the full topic. What you see on the board there is it can't fit. It cannot fit, so I have to shorten it. But what I discussed today, this is the full topic of what we discussed today. Important question to ask your doctor after you start a new diabetes treatment. And I give you guys 11, 12 questions. I'm going to just go through them fast, and then we'll close for the day so that you guys, and then I said these are the questions to ask to your daughter for the first year. Okay, let's go to the number one. I said this is number one. Are these side effects related to my medications? Okay, I did explain it. You guys have to watch the video. I did explain it. And number two, I say, will my side effect go away? I did explain it on my video. Number three, I say, are my blood sugar levels okay? Okay, those are the questions you're supposed to ask your doctor. Number four, how often should I check my blood sugar levels? All right. Number five, what are some signs that my blood sugar is too high or too low? I explain everything in the video. Once I download it, you guys can listen to it. Number six, can you check my A1C level to see if my numbers have improved? Okay. Number seven, do I need to tweak my diet or exercise plan? Okay. And number eight, can I have my cholesterol and blood pressure checked? Number nine, can you check my feet? Okay. And number 10, will I ever be able to stop this treatment? Okay. And number 11, should I have my kidney function checked? So these are the questions that I explained in details in the video, what we did today. So if you want to listen it completely, you got to watch the video in full. For those that are joining us late, so this is what we discussed today. All right. So, all right, Mercy Sibanda, you're welcome. Siabonga, Mercy Siabonga. Okay. So, so those are the questions that we discussed today. All right. So, so those are the questions. So I'm going to let you guys go now and enjoy your Easter with your family. Tomorrow we're going to meet the same time again in the morning or afternoon, depending what time you join today. Not those that are joining us late, like Francis. Those that are joining us from the beginning of the program. Okay, for another program tomorrow Sunday. Okay, and then one more thing I have to share with you guys. I did say, okay, we have a new page on TikTok now. Okay, so go to TikTok. I know I have a dedicated followers. Okay, there are people that just say they are following me, but they are not dedicated. You cannot see them here. They don't even watch the video. They don't even come on live video. They only just come, so say they are following, and they only show up once in a while and then go. They don't even watch the video. So if those that are dedicated to this page, following me all through, go to TikTok. This is the TikTok, the name on TikTok, Managing Diabetics, and then follow me also on that page. All right. So it's a new page. From next week, I'll also be streaming. From next week, I'll try to make sure I'm streaming live the way we are doing live now on TikTok. But for now, there are videos I shared on that page. So if you are not yet following me, okay, go to TikTok also and follow me, Managing Diabetics. That's where you see who are dedicated followers. There are die-hard followers. There are people that are die-hard. They follow you all through. Anytime you are live, whatever, when you download the video, they watch your video. There are followers. They are just there, just say they are followers. They don't watch your video. They don't follow you. It's just once in a while. So if you are dedicated followers, or if you want to count yourself as a dedicated follower, you go to TikTok and also subscribe and be part of the family. Want to expand the audience. All right. I'm also on Instagram and YouTube. So this is my page on TikTok. So go there and subscribe. So thank you guys in advance for subscribing. So I'm going to let you guys go now. Let's meet tomorrow, Sunday, again for the next program. Enjoy your holiday. Enjoy your Easter weekends. And do not be carried away in terms of what you consume. Be cautious of your diabetic status to make sure you make a wise decisions in what you drink and what you eat. Let your yes be yes and let your no be no. Do not be forced to eat certain things you are not expected to eat. All right. So I love you guys. All right. Thank you, Francis. Okay. So let's meet once again tomorrow and have a wonderful evening or afternoon or morning, depending on your locations, and then stay blessed. Bye-bye.